watching CBS 2 News This Morning in high definition.
Coming up on 6:25, they say when you're in love, your heart skips a beat or two. Well, that's a pretty good thing.
But some heart palpitations could be a sign of a serious problem. And how do you tell the difference? That is what Dr. Max Gomez is here to tell us all about this morning. Good morning.
Well, you know, pretty much all of us are going to have a skip beat every once in a while or at some point in our lives, even without being in love. The technical term is arrhythmia, and the vast majority are completely harmless, but some need medical attention.
I'd start up a hill and find that I was out of breath, and I knew I shouldn't be because I wasn't a smoker or anything like that, and in good physical condition.
Ed Kerwin was in great shape. He and his wife Lynn were cruising the Pacific in their sailboat, eating healthy, exercising. Turns out those heart palpitations were something called atrial fibrillation, a common arrhythmia, but which can lead to a stroke.
All of a sudden felt real lightheaded, and I thought it was caused, and I was sort of swaying like I had been drunk. But I couldn't put my hand in my pocket. I missed my pocket, and I was slurring my words.
Ed recovered completely from his stroke, but he's an example of what some heart rhythm abnormalities can lead to. The key to evaluating any heart rhythm abnormality is an EKG like this, which takes just a few minutes. The tricky part is that you have to catch the arrhythmia in the act. So your doctor may have you wear a heart monitor for a day or more so the palpitation can be recorded and analyzed. But the vast majority of arrhythmias are completely benign. So how do you know if your heart palpitations are something you should see your doctor about?
A rapid heartbeat that goes on maybe for many minutes or hours is certainly something that warrants immediate attention. If the individual experiences more serious symptoms that accompany the palpitations, such as chest discomfort, trouble breathing, faintness, or frankly, if they actually lose consciousness, certainly that warrants immediate attention and they probably should go to an emergency room.
That's especially important if you already know you have heart disease, because then your arrhythmia could be a warning sign of an impending heart attack. Treatment for serious arrhythmias can range from medications, which usually have to be taken for life and can have side effects, to interventional procedures that destroy tiny bits of tissue in the heart that give rise to the arrhythmias.
Many patients would prefer a curative approach to a lifetime of treatment by medicines.
Now, there are many causes of arrhythmia. Some are congenital, some like atrial fibrillation are more common with age, and others come from heart damage after a heart attack. But remember, anything like palpitations that last hours or longer or causes lightheadedness or fainting, that's when you should go see your doctor right away. But most of them are just an occasional skip beat, and they're benign.
Surprising that everyone has them, or just about everyone has them.
Well, if you think about it, the heart's beating thousands and thousands of times constantly. Every once in a while, it's going to make a little mistake.
Right.
Don't make too many, though.
Right.
Not too many,
Something
exactly.
to closely monitor and watch as well, especially if it goes on for hours. Thank you very much.